I'm diagnosed as a stage 4 cancer patient.
Yeah.
The breast cancer is now in my spine, and I am undergoing treatment once again at Yale. But because the treatment failed me the first time, and the chemotherapy at the time was very, very powerful, I opted out of chemo and I opted for alternative therapy. Well, actually, I heard about it through my daughter, who lives in Denver and who works in the field, and who was 10 years old at the time of my first diagnosis. And she said to me that she was so powerless when she was 10 years old, but now she could help me.
Yeah.
And so not having any faith in the main routes of treatment that were offered to me by the standard medical authorities, I opted out of that treatment and went with the CBDs. So I obtained a medical marijuana card in the state of Connecticut where I live. And there are only 6 dispensaries in Connecticut. And I have been getting my cannabis oil through one of the dispensaries. I was diagnosed in November, and I started with the CBDs in December, so almost right away. In fact, I started using them before I legally had a card.
Okay.
All I can say is that in the last 6 months, my numbers, the numbers that you would normally follow with somebody like me, such as CEA, which is the cancer embryonic antigen, the CA2729, which is the metastatic marker, as well as my serum calcium. They've all been within normal limits. I seem to be doing fine.
Yeah.
My pain is negligible, and I just I feel that I really don't need to resort to the formal therapeutic modalities. I'm happy with how I'm doing right now.
Yeah.
I'm really interested in the anti-tumoral effects of the CBD and the THC. And I've read a little bit. I know that out of Israel there's been a lot of research by medical doctors. And I know that there's research out of Canada. And there's also a woman in Mexico, I believe her name is Dr. Cristina Sanchez, who is primarily working on the anti-tumoral effects of cannabis. She's been doing that for 10 years when she started having some unexpected results in the laboratory setting. I have felt that a few times, but because I take it mainly in the evening, although lately I've been staggering it through the day.
Okay.
And that also works because I'm getting my dosage in, but I'm not getting those effects. But if I take one big dose at night, it has happened to me, and I don't know if it's a function of what I've eaten or whether I'm tired. I have no idea. But I may get a little dizzy, I may get a little anxious, and I generally have to go to bed. What's encouraging to me is the fact that you can't overdose on it, which you can with a lot of other medications, including chemotherapy, which is a poison in itself. As we know, it damages healthy cells as well as cancerous cells. I don't see a downside, and the research that I've read also says that it's an enhancement for the immune system. So that means that anything that's autoimmune, and even diabetes is obviously, it's just has an abundance of medical advantages. And I do have a pharmacist. His name is Nick. I call him up. He knows me, he knows my diagnosis, he knows my situation, he knows what I'm looking for, he knows that I'm not looking to get high, I'm looking at the anti-tumoral benefit. I know what I'm taking, and I know how to take it, and if I stagger it during the day, I'm absolutely fine.
That's great.
And lucid.
Okay.